I'm pleased to be joined today on Health Beat by Dr. Zackary Gangwer, a podiatrist specializing in foot and ankle surgery with Faith Regional Physician Services Orthopedics in Norfolk. We're talking about ankle replacement. And when might someone need this, and how do you go about replacing an ankle, and more importantly, can you have a real foot and a fake ankle?
That's a great question. But all jokes aside, we've come a long way with the technology involved in the ankle replacement. Historically, we had to fuse the ankle, where obviously you lost the motion, which led to some other issues to the other joints around the ankle. Over the last 10 years, there's been a lot of advancement in the technology. And as you can see on the image here, there's two metal components, one on each side of the ankle, and the space in between is filled with a piece of plastic. And what these components provide for patients is still the pain relief that we've always sought with the ankle arthritis, but it also allows motion so that the patients can remain functional. The surgery is something that's done in the hospital. It involves, staying in the hospital for a day or two. Mm-hmm. There is a time of not walking on it, but in the end, after the recovery, the patient's able to function much better with the pain relief that they're seeking.
I see. And so the mobility that you would expect is pretty much what you want? It's the same as it was before?
Not as same as it was before. Obviously, a healthy ankle with no disease is going to function better. But they've come along to the point where the function is, advanced enough where the patient doesn't put the stress on the other joints in the foot that the fusion used to do, and so they can get a longer time out of their foot, so to speak.
I see. Absolutely fascinating stuff.
Yeah.
Well, thanks so much for joining us, and that's Health Beat, brought to you today by Faith Regional Physician Services.